Ms. Dahlkemper.
Thank you, Madam Chair. I want to thank you for hosting or holding this very important and timely hearing today. As we move towards universal coverage in healthcare reform, it's essential that we address this future physician workforce shortage. The Council on Graduate Medical Education has predicted a 10% shortfall of physicians by 2020. And as we've seen in Massachusetts, healthcare reform will only exacerbate this impending decline. In healthcare reform, we must strive to not only expand health insurance coverage, but also to provide everyone access to physicians. These physician shortages are particularly troublesome in rural areas, such as my district in western Pennsylvania, since less doctors tend to be attracted to fill those positions in the rural areas. In this vein, I was pleased to see the additional funding for the National Health Services Corps, which was already mentioned today. And we also need to address the debt that the students carry, which was just talked about. But I wanted to ask you, Dr. DeMarco, that there's 2,500 hospitals in the United States that do not have teaching programs, and many of these are located in those rural and suburban communities. As a solution to our workforce shortage problems, the American Osteopathic Association recommends expanding the number of teaching programs. What steps should be taken to achieve this goal, and what kind of support would hospitals need to build these programs?
Well, of course, it's a brain drain issue, but the thing is that in the country today, six states are responsible for 80% of the training. One of the advantages we've noticed in the osteopathic professions, we've opened schools in rural areas where there are hospitals that never had interns and residents. Fortunately, there's a loophole in the Balanced Budget Act that says if it's a hospital that's never had an intern or a resident, you can cap that hospital at a new number first time. And that's what we're achieving at this time. We have hospitals in Colorado, in Denver, in Mississippi, Yakima, Washington, in California, where there have never been residents and interns, and all our new schools have all their slots already preordained prior to the first graduating class. And that could be done across the whole country.
Would anyone else like to address this, Dr. Sheldon?
I was a charter member of COGME, and candidly, they've been part of the problem. They've said there's a cap. There was a study done the second year of COGME that not only talked about the primary care shortage, but about 6 stress specialties, which included 2 in surgery. And COGME is late coming around to recognizing the projected needs for the future. A number of other groups were way ahead of them on that.
Dr. Hyde, did you want to?
I practice in actually the poorest county in North Carolina right now, and certainly appreciate the need to have more attention paid to the rural areas. When I discharge a patient from the hospital, I often cannot find anyone to take care of that patient. So simply having insurance, even if their bill gets paid, there's nobody there for me to refer to. We also, as part of the patient-centered medical home demonstration project, where we're looking with residencies in a demonstration project to see new ways of doing training, likewise have been moving residents from the traditional tertiary big hospital out to small community hospitals as an innovative way of improving their training, providing some workforce to the rural, and also decreasing costs. We also think that you have to change the payment system and make sure that healthcare insurance is available for all, because otherwise it is the small rural hospitals that are really struggling when you have a very high proportion of your population that gets admitted or comes to the emergency room for which there is no then adequate reimbursement for them.
Thank you. I have one last question. Dr. Harbaugh, you were talking about the foreign medical graduates. I think maybe Dr. Sheldon was addressing this too. What percentage of those who take those residency spots, what percentage of those are staying here, and what percentage are actually leaving?
To my knowledge, the vast majority stay in the United States. Dr. Sheldon may have more access.
It's well over 60%. India has some more medical schools than we do, and they'll often send people here with a plan to go back, and probably more of that's happening now, but the number is way, way up.
I was wondering, just with the change in kind of the global climate
Yeah.
and some of these countries.
Well, you can take Guana.
Maybe attracting more of their students back to
Yeah, well, sub-Saharan Africa has a real problem. The Guana had, I believe, 1,200 graduates, half of them practice in the United States today. And their ratios, if you look at the World Health Organization chart, is just dismal. We shouldn't be robbing the other countries to fill our own residency